Welcome to Scrub In, a podcast where purpose meets care. We are more than just a podcast. We are real stories of hope, expert health advice, and inspiring conversations with the people behind the scrubs.
This podcast will leave you informed, inspired, and reminded of the purpose that connects us all. It's the voice of humanity in healthcare, uplifting, honest, and full of heart.
Featuring hosts Dr. Kendall Barton, Keisha Morris, and Alice Roush. You can listen and subscribe on Apple Podcasts, Spotify, Google Play, and YouTube. Or visit bayhealth.org/scrubin to learn more. Now, let's scrub in. Here's our next episode.
Welcome to another episode of Scrub In, and a quick shout out to all of our new and returning listeners.
And as you know, we start every podcast with a quote. And so today's quote is, "Technology is best when it brings people together." And that's from Matt Mullenweg, who is the founder of WordPress.
Awesome.
So what are we talking about today? I am super excited about this topic because it's a hot topic, not only in healthcare, but in the world. And I can't wait to get started with this. So today we're going to be talking about AI in healthcare, and specifically how technology is helping clinicians care better.
Very exciting. And I am also excited to be here with my good buddy and colleague, Dr. Jonathan Kaufmann. Why don't you go ahead and introduce yourself?
Well, I'm excited to be here as well. So that makes three of us. Thanks for having me. My name's Jonathan Kaufmann. I'm the Chief Health Information Officer at Bayhealth, Vice President as well. I've been with the organization for about 11 years now. And while not a Delawarean by birth, I've been here long enough where I guess I'm a Delawarean. Pittsburgh originally. I married a Delawarean, and I've been here for many years.
So Dr. Kaufmann, tell me, why did you get into healthcare? What was kind of that spark that really initiated this career for you?
So, I really appreciate the question. And I think the question you asked, the why question is such a great one, because we all have different reasons for doing what we do. For me, I go back to when I applied for medical school. They always ask you the question, why do you want to be a doctor? And I answered, because I like helping people. And as one does after you interview for med school or anything, you kind of compare notes with the other people that are around, and they're like, you said that, that's so cheesy. You got to come up with a better answer. I got into med school so I could say it was good enough, but it was the truth. I love to help people. My career, if you had asked me back then or even in college if I would be doing what I'm doing now, which is really sort of the marriage of technology and medicine, I would have told you that there's no way this is going to happen. Even when I finished medical school and then residency afterwards, I just wanted to be a hospitalist, which is a type of physician that just takes care of people in the hospital. It was a great schedule, a week on, a week off. My wife and I had moved to Hawaii actually for about just to get away from family and do something different. But I just fell in love with technology and where it intersected with medicine. I started to see how it made my life as a practicing clinician better in terms of efficiency and quality and safety. And then I just started to see how marrying these two things together could make healthcare in general better, not just for me and my patients, but for my partners and their patients and the whole healthcare system and their patients. And then eventually, taking it all the way to population level health.
Awesome. So tell us a little bit more about what you do in the community outside of work.
Sure. So I'm a giant nerd. I guess that's sort of another one with what I do for a living. I have 3 kids. A 6-year-old daughter, a 9-year-old son, and an 11-year-old son. So a lot of my world sort of revolves around school and community. We're pretty active with our school in Middletown, and our religious community up in Wilmington. So I coach soccer for my son. We do a lot of magic card playing and Pokemon card trading and that kind of stuff as well. I also love to cook and just make people fat, I guess.
What's your specialty?
My specialty, so I don't like baking. Baking is too exact. You got to measure everything. I like to kind of, and actually I use a lot of AI to get to the topic of, okay, well, I have these 7 ingredients. This is kind of what I think I want to make. help me find a recipe. So I use kind of, I marry the technology with kind of what's in my head and what and allow it to kind of and assist me to do what I'm trying to do.
That's awesome.
So how has that changed the way that you just even live your life? I know we use AI in so many different ways. Do you find that it's enhanced your life, gave you different perspectives? What's kind of your number one win that you found from that?
Yeah, no, I think it's fun and interesting to see how these things have sort of emerged. And I think, just looking forward 5 years, they'll laugh about how we used AI as it was birthed, to use, maybe the wrong term. But in my life, I use it and have used it for many years. People think of AI, the generative AI, the chat GPTs, those are really only about 2 to 3 years old. But whether it's predictive text, like when you're auto correcting yourself, some of that stuff goes back years and years, to make really focusing on efficiency. But the generative AI stuff, I have a lot of Alexas in my house. We ask Alexa a lot of questions, probably too many questions. But really to augment what I'm doing or to fill in knowledge gaps. I remember going to the library with my list of questions when I was a kid of like things I had thought about and wanted to look up. Now you sort of have instant access to all that information. So really, it's more of a knowledge partner. Yeah, to me, not bad.
That's great. So you had mentioned using AI with your recipes and things like that. I think that's a great point. And I think it's a good transition into on the healthcare side of
Sure.
things. In your experience, what have you seen AI use, just kind of in broad terms, in the healthcare field so far?
Yeah, so I think I think healthcare has been using AI sort of maybe undercover a little bit for many years. Radiology is probably the most mature space. Radiology uses it for a couple of different use cases, and we at Bayhealth here have been and continue to do so. One is sort of as a partner, as a triage mechanism. So our radiologists will get a list of scans, and the AI will kind of take a run through all of the scans. And please forget, it's a lot more complicated than that. And if the AI sees something that's concerning, it'll flag it and push it to the top of the radiologist list. And so that allows them to focus on the tests that need to get read first, which may have life-saving implications or radical treatment implications for someone in the emergency department or up on the floors in the hospital. And so radiology has been using it in that way for many years. We've started to use it more for rapid identification of stroke, and it will fire off alerts to get the care team mobilized to help take care of our stroke patients. But that's probably the most mature aspect of it. We also use artificial intelligence for things like looking for patients that are going to deteriorate or readmit. So for predictive purposes. So if I can intervene on this patient, whether it's I think they're going to come back to the hospital, or I think they may develop sepsis or a bad infection while in the hospital, maybe we can intervene on them. And then lastly, most excitingly, we're using it to help clinician wellness and clinician efficiency. So at Bayhealth, we have been doing some pilots of ambient voice listening, which is where a clinician will put a smart device or smartphone down. That smart device will listen to the conversation, and then it will help generate the note for the physician. And actually, 2 days ago, we went live with AI summarization in our chart system. So Epic is our EMR, our electronic medical record, and you press a button, it scans the chart and kind of surfaces all this awesome information that you would have to kind of hunt and dig and ask and click around to find. And so very excited about that go live on Tuesday of this week.
Oh, that's great. That sounds like that's some amazing innovations that are happening at Bayhealth, and our patients can really benefit from them. I'm just curious, how do you prep the patients or prep our patients to know that AI is being used either in their office visit or being able to look at their charts? Is there anything that we do to kind of like be proactive about that?
Yeah, no, I think a lot of patients either expect it because it is such a valuable tool. They're using it in their, we always talk about Dr. Google. Patients would show up with a stack of papers with sort of what they thought they might be wrong with them or the treatments that they thought. It's just gotten better, frankly, with ChatGPT and some of the other AI assistants like Gemini. I think like anything, talking to folks, having them understand that their data is safe, as safe as is possible. We at Bayhealth partner with market leaders with both the technology as well as the IT security. All of these products go through an extensive vetting process with our IT department and our legal department as well. But I think, again, all of these things are tools, right? Tools can be, if I give my kid a hammer, bad things are going to be happening. But if I give it to a skilled contractor, I'll have a new first floor of my house. And so AI is similar. So we have to explain to them how we're using these tools, why it's in their best interest. The ambient voice listening, everyone loves it. Like, instead of the doctor, there's a classic picture in one of our journals that a small child had drawn of the doctor after a visit, and it showed the doctor at a computer with the little girl sitting on the bed, and the physician was not facing the patient. And it's just one of those eye-opening kind of images. And this is changing that. It allows us as physicians, and it allows patients to make eye contact, and to read body language, and to remove this screen from the doctor-patient relationship. And it has almost universally been well adopted and liked by both patients and physicians. But I do think your question is pertinent, that folks need to know that it's being used and how it's being.
Yeah, great answer. Thanks.
So I'm curious to get your opinion about, because I know you still see patients, and how your experience has been. I know personally, like a lot of things, like any information out there, it's important to know where you're getting it. Is it safe? Is it correct? Is it backed up? Is it evidence-based, especially in the field of medicine? And it's the same thing with AI. There's a lot of information. Patients will come in and say, I used AI to tell me about this medicine, and it's actually incorrect. And, I think I was a little skeptical to get involved with AI as far as healthcare goes. But going back to what you mentioned about the recipe, I do think there's some things out there that initially with AI right now are very beneficial to patients. Diet, exercise. A lot of patients don't have access to a gym or even, because groceries can be expensive. So, being able to plan out what they're shopping and to be able to financially, get through some tough times. I've actually had patients use it for that, and it's been a great experience. And, for those who, like I said, don't have access to weights or things like that, it'll come up, it'll tell you, hey, use what you have around the house for exercises. And even, using videos on YouTube for that example, and it'll direct you to those. So
Yeah.
how about you? Have you seen much?
Yeah, no, I think one of the most fascinating things about AI is how all of us use it differently to some degree. I mean, I think there's some common themes. I agree with everything that you said, but one of the things that I have to almost remind myself every time I sit down to think about how to interact with the technology is something called prompt engineering, which is a very fancy way of saying, like, what are you going to type in or say to ChatGPT to get what you want out of it? And what I find so fascinating, instead of reading an instruction manual or watching a YouTube video on how to use ChatGPT, you literally just ask it how to use it. And I think that is such a weird but like powerful thing that this technology has. Is, I'm a patient, I'm struggling with X, and I have Y. What are 7 prompts that I could give you, ChatGPT, to help me accomplish this goal? And it will spit out 7 or 8 things that you can either, okay, number 3 looks interesting. And so you can start, you don't have to come up with this crazy scenario to ask it. You can ask it to help you ask it.
Interesting.
And it's just, it's almost, it's difficult to even say out loud, but the idea of using the technology to help you use the technology is something that I don't think a lot of folks are thinking about when they sit down to interact with it.
That's a great point. I love prompt engineering, and when I finally kind of became aware of it, I had the same revelation that I can really ask you something kind of half baked, and then you're going to tell me exactly what to ask you in order to get you to get me what I really want. And really empowering our patients to be able to do that is so important because it's a way for them to advocate for themselves in spaces that maybe they wouldn't have even known about. Have you found that to be the case?
Yeah, I think, and you mentioned it getting it wrong. We use the term hallucination. The AI, it's not alive. It is just ones and zeros of fancy math, but it wants to please you. It wants to give you an answer. And so what they found over time is that it will take that and make stuff up or hallucinate. And especially in highly specialized fields, where there may not be answers, it will sort of fill in the blanks. It has gotten better, and so every version of ChatGPT or Claude or Gemini that you use is getting better and better. Again, when it comes to prompt engineering, to say, if you don't know the answer, say you don't know. Don't hallucinate. And again, it's just a weird thing to have to tell the thing not to do the thing that it shouldn't be doing. But the stronger your prompt, the better you're going to get. So I do think patients are engaging in it and educating them on how to use the technology. And then also understanding that there's an art and a science to this. So just because ChatGPT says this is the treatment that might be necessary for you, Dr. Barton or myself, who've been doing this for a long time, may have had different outcomes or different suggestions. But also, we're only human and we only have our lived experience. So having clinicians be open to embracing what patients are bringing in and not sort of saying, I'm the doctor and you're the patient and ChatGPT is always wrong. To see it as almost a trusted partner, as an assistant in the care of the patient.
Yeah, definitely something. I've seen some patients be embarrassed to admit they're using it because they don't want me to judge them. And I have to remind them that, hey, again, it's not a matter of you using it. It's about using it properly. And I'd rather you talk to me about it so I can make sure that the information it's spitting out at you is coming from at least a place of sanity.
Yes, I agreed. We only get patients for 15, 30, 45 minutes once every 3 to 6 months. This technology is literally in the palm of their hand. And so I agree. I've had patients sheepishly say, I looked this up, or, when they start saying stuff and you can kind of tell that they're talking about things they don't really understand or using words that they don't get. And again, that's where that art and science of being a physician comes into play. Hey, did you look that up or did you find that on ChatGPT? Great. Like, let's pull it up right here and let me show you how I use it. Or, let's fix your prompt a little bit. It's a tool, and we only have a short amount of time to jam all those things into a 15 or 30-minute long visit. But I think it's time well spent with the patient.
For sure.
So, Dr. Kaufmann, you spent a lot of great time talking about kind of the benefits and how we can use it to better ourselves in various ways. Have you experienced any hurdles with AI? And if so, can you just talk a little bit about that?
Yeah, I think there's certainly a learning curve. I mean, we've talked about prompt engineering. You have to learn how to use this technology. It is not instantaneously just good out of the box. I think one of the things that the physicians are very used to keyword searches. So we use technology or products out there for looking up things. So if I type in high blood pressure into my search engine, I kind of know how to get to where I need to go. Whereas to type, I have a 42-year-old male with high blood pressure and yada, yada, yada. You can spend a long time typing in a prompt when really you only need a small piece of information that you could have found a different way. So it is not the right tool for every job. And to expect it to be able to do everything, I think is not appropriate. I also think that there are some unrealistic expectations for what the technology can do. We talk about radiology, like why do we still need radiologists? The AI can just scan every CT scan and just, well, no, it's very good at what it's good at. So we still need humans. We still need people to do this work, just using the technology to augment it. So, just I think setting expectations and realizing it's very good at what it's good at. But where it's not good, you need to use other tools or your own brain.
And I think, on that subject, I think some people's fears is AI going to replace me? And I think you already kind of hinted that it's somewhat, but any other advice you give to those with those fears?
Yeah, no, I think it's natural. And I think, the optimist in me, and I think the realist is that it will become a trusted partner. I think you can see the dystopian future that, the AI is doing a lot of the work that us as physicians do, especially the question and answer and stuff like that. Whereas it can't put central lines in, it can't do procedures yet. But it can't hold your hand. It can't look someone in the eyes and empathize and help you through a really difficult situation. So I don't think it's coming for all of our jobs. But what it is going to do is change the work that we're doing. And so I think this idea, a physician literally texted me yesterday, I feel like I'm cheating because this summarization tool that we just went live with is helping him do his discharge summaries. Well, now he can go home and see his family. He can go home and do his, whatever, or free him up to go see another patient if he needs to or wants to, or to sit at a bedside instead of typing for 45 minutes to get the, so, I think overcoming that and learning that we have time and the ability to do some of the other things because we've been freed up by the technology.
I love that. I love being freed up for things, right? That you really, really want to do.
And that's what makes it so exciting is like, and I have a big smile on my face. And when I run into people only call me when there's problems generally. I don't get calls for like, hey, it's going great. Just want to let you know. But I did get calls and texts yesterday and today and said, this is awesome. Like, this is helping me. And that to me is incredibly powerful when folks feel the need to say, hey, this is good.
Yeah. So what other innovations can we look forward to at Bayhealth and in healthcare in general?
In healthcare in general, I do think I'm very excited about the ability to have the technology sort of look at you and help me and the other clinicians taking care of you, personalize your healthcare. So, right now we're talking about summarization, we're talking about triage, but being able to look at the list of medicines that you're on and the latest evidence that just came out and your socioeconomic needs or your healthcare determinants, all this stuff, and to come up with an individualized treatment plan and surface that to a clinician, I think is what really excites me. And I think we're a couple years away from that. And where I get nervous and concerned is like, how do we do that in a way that's feels good and feels natural and is not intrusive? But we are building some new towers, or we're going taller on our new tower at the Kent campus. How do we build the hospital room for the future, right? Like when you walk in as a physician, having the screens show you what you need to see. And then when you walk out and the nurse walks in, have that technology sort of rearrange itself. And maybe when the patient's by his or herself, having that room sort of support the patient and what they need, whether it's education or translation services or whatever. That's what I think we're a few years away from, but really, really gets me excited.
That's awesome. So Dr. Kaufmann, I'm curious about how, as a system, we plan to use AI for our non-clinical staff. You shared, all the innovations that are happening with, our clinicians and what's happening with patient care. But how about those that support the work that our clinicians do on a daily basis? What's happening there?
Yeah, I appreciate the question. I think Mr. Murphy, who's our CEO, sent me an article yesterday, as well as our CIO. Organizations are trying to figure out what their strategy for AI is. And really, AI is not something that you just sort of strategize for. It's going to be part of how we, as an organization, move forward in all areas. And so we shouldn't have an AI strategic plan. We should have a strategic plan about and incorporate AI as a means to accomplish all those things. And so when we talk about, non-clinical uses of AI, it's about productivity, it's about automation. We just had a new CIO, our chief information officer, join us, and his philosophy is automation first. How do we free up people who have been doing repetitive tasks over and over again to do more complex work. So we have deployed some artificial intelligence within Epic for billing and revenue collection type activities. And we're also deploying Microsoft's Copilot, which is a suite of tools that integrate with Word, Excel, PowerPoint, and acts as sort of a secure office assistant, and will surface things in your email or help you analyze a spreadsheet or make a pretty PowerPoint, because I'm terrible at PowerPoint. I need lots of help with PowerPoint. And again, just make us more efficient in the work that we do. Healthcare is a knowledge um, uh, industry, and with reimbursement and just sort of the whole industry being asked to do more with either the same or less, we have to get more efficient. And these tools, I think, are helping us. I know HR is talking about using it for how do we cast a broad net to get applicants in and through the process faster. So just looking at different use cases where automation or summarization fit in is where we're starting to see it sort of pop in.
Awesome.
Well, I gotta admit, like I said earlier, I was a little skeptical of AI at first, but the more I've experienced it, and a lot of what you said, I haven't experienced firsthand, but my colleagues have, and I've heard the great feedback. So I think there's a great future for AI in healthcare, and I'm very excited myself, and I appreciate you being here and talking to us. If you had to give one takeaway to our guests from what we've talked about today, what would that be?
I think it's pick one of the tools and ask it how it can help you. And it can be broad or and just in a open-ended kind of way or in a highly specific. But give it a shot. Give ChatGPT a shot. Don't own stock in it, or Gemini or Claude or Anthropic or any of the ones that are out there. Meta, I think, has one. These tools, I think, are very, very powerful, and are worth kind of playing around with to see how you can integrate it into your work. It's awesome.
Awesome. Well, Dr. Kaufmann, we've enjoyed having you today and you sharing your expertise around AI and AI, especially in healthcare. We look forward to seeing all the innovations that are going to happen within our system, and I'm sure our patients will be able to appreciate those as well. So thank you so much for your time today.
Well, thank you for having me.
And thank you for joining us today. We've had a great episode, and we hope that you're able to take the tips and tricks that you learned here and really put it into use for yourself. So thank you for joining us.
Thanks for listening to Scrub In, where we bring purpose and care to every conversation.
If you enjoyed today's podcast, don't forget to subscribe, rate, and review on Apple Podcasts, Spotify, and wherever you listen.
Stay connected, stay informed, and stay inspired right here with Scrub In.